Hello everyone. Today I will give you the class about physical examination of cardiovascular system. Now, before the class, I want to give you a short introduction about myself. My name is King Squad. I came from cardiology department, Shengjing Hospital of China Medical University. Now I was attending doctors in my department, and my major in EP and pacemaker implantation. So if you have any questions, you can also contact with me. And because today's class we count face to face, so I can't have you face back. I don't know you where you understand or you want me to give you some detailed information. So if you have any questions or feedback, you can contact with me. I will leave my email in the very end of the PPT. So based on the past experience, some patients or some students, medical students, may ask me some questions about, I want to do the pacemaker. I want to do this chief surgery doctors. But as for me, what means to me most, I think you need to study very, very hard on today. So you will be prepared for tomorrow to be qualified to turn into a clinical doctors. So today's class will be ended in a few minutes or just maybe half an hour. But I think what I want to say that is you need to stay hard and repeat again. Then you will be qualified to be a clinical doctor. Now I will begin my class today. See, that's why I give 4 marks, but based on the past experience, auscultation is the hardest part of heart physical examination. So it will be taught by another professor. Use more times to give you to learn. So I will tell you the 3 parts of all the classes. First is inspection, and second, palpation. 3, percussion. Now, generally consideration. During our lifetime, the heart contracts more than 4 billion times and pumping about 200 million liter blood to systemic circulation. And cardiac output varies under physiological conditions from 3 to 30 liter per minute. Heart rate varies from 60 to 150 beats per minute. So just imagine how imaging organ we might. So I was so fascinated by it. So I chose to be a cardiology department doctor. So generally speaking, and in the present year of technological advances, particularly in various imaging modalities, such as MR or PET-CT, physical examination of the heart still provides useful information. Just to give you an example, like that we both have hands, but we don't only have hands, we also have fingers. It's like that. This finger is like medical history taking, and this is a physical examination, what we can focus on today. And this may be the ECG, this may be MRI, ultrasound, X-ray, and this can be lab test. We can't lose every one of them, just like today's physical examination class. Because I was once asked by some student, they asked me that, teacher, I don't need to do any body examination because I can have an ultrasound. Then I know the wall disease. Because I can do a ECG examination, then I can get the heart rate. But for me, I can't agree with that, because just like our hands, we can't lose every fingers. And each fingers, they work together to make our hands can work normal. So considering this, the physical examination, it is a simple, convenient, cheap as premier assessment of the severity and the etiology of the lesion, and also serve as a clue to use advanced technology for the diagnosis of cardiovascular disease. So when you see this moving video, so we can see the autonomy of the heart and its beating. You can see the esophagus and the trachea and the veins and the arteries in the heart. This can give you a direct impression about heart. And second, we can see that because the patients are living, and when we are living, we are breathing, and this cartoon can give you an impression about the autonomy of the heart and its neighbor organs. We can see the diagram in the lower part. We can see the lung. They move together. And next, we can see this is the heart when you're seeing the patients from the AP position. We can see there is LV, RV, PA, aorta, supernal vena cava, right atrium, and you can also see the fat tissue on this way. Remember this picture. I think we can use more later. Now, before we doing the physical examination, the routine and techniques of the PE of the heart, because if you want to make a body check, you must make sure the place are safe, the patient's exposure and position with enough light and appropriate room. And thanks to the video, to the internet today, the very first thing I want to give you a notice is that you need to protect patient's privacy. So, because they can send Instagram, they can send Facebook. You may, if you don't take care of this one, you may be sued by the patient. So watch out this. And after doing this one, we can continue to the second part. And thank you for listening.